Hi, welcome back. So continuing on with a series of videos on massage in pregnancy and postnatal health issues. I'm today going to be talking about something that I've seen quite a few clients with, which is symphysis pubis dysfunction, or sometimes referred to as symphysis pubis diastasis, or SPD, and how massage therapy can help with this. So SPD affects around 60% of first-time pregnancies, and around 81% of second pregnancies. And if you've had it in your first pregnancy, you are much more likely to have it again in the second. It usually, if you get it in a subsequent pregnancy, it usually occurs earlier as well. Generally, the relaxing hormone that relaxes all the ligaments, that usually kicks in at around the 20-week mark, which is usually when the SPD really starts to affect women. But it has been known to occur as early as 12 weeks. And so certainly in subsequent pregnancies, this is more likely. What a lot of women don't realise is that also it's not necessarily just a pregnancy thing. Although it starts off being a pregnancy thing, it can actually in some cases continue to be an issue postnatally. Also it can occur even if your pregnancy has shown no signs of it. It can actually occur during the labour itself if you are in a position where your legs are in stirrups for a prolonged period of time. What is SPD? So in SPD, basically what happens is, in the centre at the front of your pubic bone, which is this, in the centre at the front you have like a disc of cartilage which separates the left and the right sides of the pelvic bone. And this piece of cartilage here is called symphysis pubis. Now, in some cases, the relaxin hormone, as we've said, is released from around 20 weeks of pregnancy. And this is released because it basically causes the ligaments to relax a little bit. It allows everything to stretch to basically prepare the body for the labour. But in some cases, when the relaxin is released, this causes the ligaments and the cartilage in the middle here to relax. And what this then does is it can cause feelings of instability around the hips. It can cause pain around the groin and hips whenever you move. Anything like walking, standing for longer periods, walking up the stairs, turning over in bed, getting in and out of a car. These can all become, very difficult and painful. And there can also be instability in the sacroiliac joints here at the back of the pelvis. And as we've said, while the pain will generally disappear following the birth, it's essential to get early diagnosis of SPD so that you can manage the pain as much as possible during the pregnancy. And I will also be talking about some things you can do to help with those feelings of instability around the hips as well. So, what are the factors that basically contribute to developing SPD? Well, any kind of previous pelvic issues are likely to mean that you've got some kind of weakness, you know, already sort of in the soft tissues around the pelvis, you know, which means that you're at a high risk of developing SPD, or any misalignment of the pelvis. You know, maybe you'd been in a car accident as a child, and you know, perhaps you'd had some sort of trauma to your pelvis. So that's obviously going to affect it. If you have any kind of weakness in the abdominal or pelvic floor muscles, and that could be not necessarily due to a previous pregnancy, but maybe you have quite a sedentary lifestyle. You know, you might have a desk job and not do much exercise, and so these factors are also gonna, you know, contribute to development of SPD and increase the risk. If you have a particularly large baby or multiple pregnancies, you know, this could increase the risk, because basically anything that is going to put extra weight, you know, on the pelvis is extra pressure. So, you know, and even, you know, some women have quite a large amount of amniotic fluid. So even that potentially could put extra pressure on the pelvis and increase the risk of SPD. If you have particularly high hormone levels prior to pregnancy, or if you get an overproduction of the hormones during pregnancy, or maybe you, for whatever reason, have an early release of the relaxin hormone, you know, it sort of happens before the sort of around the 20 week mark. You know, this again could cause those soft tissues and the ligaments around the pelvis to relax and stretch, which obviously then increases the chance of SPD and instability around the pelvis. Previous difficult births, you know, may impact. Again, that you know, that there may be scar tissue which is causing a weakness in the surrounding muscles. Hyperflexibility, you know, and that could even include certain disabilities like cerebral palsy, where you know, if those joints are very mobile and naturally sort of in quite a relaxed, overly relaxed, I should say, state, you know, that again could increase the risk. Or any, if there's any reason why the joints are sort of overstretched prior to pregnancy. So, for example, if you, or through your childhood, have done gymnastics, it's kind of a similar thing to the hyperflexibility. You know, your tissues will naturally be very, very elastic, and potentially, you know, quite loose, and so therefore again are at a higher risk of developing SPD and having some instability there in around the hips and the pelvis. So how do you recognize, you know, that you might have SPD? What are the symptoms? So pain is the big one. And so that would be pain around the symphysis pubis, which is, as we showed in the diagram, that cartilage disc just at the front of the pelvic girdle, right in the centre there between the two halves. So pain there, or pain around the sacroiliac joints, which were those two on the back, sort of curved part of the pelvic bone. There's the two lines that we showed in the diagram. So pain in that area is also an indication. Also more sort of general pain around the hips, the groin, and also potentially the lower abdomen. If you've got a lot of weakness in those abdominal muscles, you're quite likely to get pain there too. Pain around the coccyx, the buttocks, and also the inner thighs. So all around that pelvic area. The pain can be mild to severe. It may be, on and off, or it may be constant. And it can really range from just a sort of like a bruised sensation, burning sensations, right up to a sort of a really sharp pain. So it's quite varied in how the pain sort of manifests itself. But certainly a common factor with the pain is that it usually it will, well, pretty much always, it will worsen with walking, climbing stairs, bending over, turning in bed, or getting up out of bed, or in and out of the car. Basically anything that involves abduction of the leg. So abduction is basically, so if you were standing and you raised your leg out to the side, that's abduction. So anything that involves that movement. You may also find that you have a sort of you feel like you're shuffling when you move, sort of in order to compensate for the pain. You may get a clicking or grinding feeling in the hips when you move. And also you may find that you have some signs of bladder dysfunction. So how do we treat it? Well, probably the biggest thing is pain control. Obviously, as we said, the fact that, the relaxed cartilage causes pain in the muscles which attach to the pelvic bone. There's a very large supply of nerve endings around this area, so it's why you get so much pain. So pain control, physiotherapy, massage, deep tissue massage around the thighs, groin and hips can ease the tension and pain in the muscles. And obviously you can watch my video on pregnancy massage to sort of find out a bit more about massage during pregnancy. Acupuncture has been shown to be quite beneficial in improving the circulation of the blood to the muscles, much like massage does, which will increase the tension and the pain. And also stretches and exercise. Yoga can be beneficial, but I would say do make sure that your yoga instructor is experienced in dealing with SPD and is aware that this is an issue for you, because there may be some positions that aren't suitable, and some things that you just have to be a bit more aware of. So, do make sure that you're with a qualified instructor. But there are, a few things that you can do yourself to really just help you deal with moving around and deal with that instability in the hips. So really rest where possible, which, can be difficult. But try to reduce activity if it's painful. And with, with those movements like turning in bed, getting in and out of bed, try and keep the knees together so that you're not abducting that leg, which is the movement that causes the pain. Getting in and out of a car. Try to swing both legs in and out together while sitting on the seat. So again, keeping the knees together to avoid the abduction movement. Try to avoid lifting extra weight, and try to avoid any position where basically your legs are straddling something. So if you are someone that enjoys sex during pregnancy, you may just have to be a little more creative with your positions, because the, woman on top position is probably not going to work for you, and will be quite painful. So probably one of the big concerns for women with SPD is, can I still have a vaginal delivery? And yeah, the answer is yes, it is still possible. But you ideally would want to avoid being in a position where you have to have your legs in stirrups. That usually happens more if you have an assisted delivery, so forceps or Von-2s, which, to be honest, if it's sort of at that stage where that's needed, the sort of necessity for that will probably override your SPD anyway. But in terms of ideal positioning for labour, certainly with SPD, giving birth on all fours would be an ideal position. And it keeps the pressure certainly off those sacroiliac joints at the back of the pelvis. But certainly ensure that your midwife, or doctor are aware that you have SPD, just in order to make any internal examinations, more comfortable. So I'm going to talk now about really how massage helps with SPD. Massage, of course, reduces pain, as we know. It can relieve joint pain and relieve muscle tension and any weakness or imbalance in the muscle. And, likewise, it will help reduce the pain of SPD as well as general pregnancy aches. But I will say you need to see a therapist who is experienced in dealing with SPD, because if you just go along for your average sort of massage with a therapist who has no knowledge of it, you're not likely to get very much out of it. Massage, of course, increases supply of oxygen and nutrients to the tissues through the effect on the circulation. Helps to regulate the hormone levels, and so hopefully will help prevent overproduction of that relaxing hormone. It also increases the production of the endorphins, which are those natural pain relievers, as well as being like the feel-good, hormones for the mood, the natural pain relievers. Just sort of through the stimulation of the skin, those will be released. Obviously promotes relaxation, and not only in pregnancy but also postnatally. It will help to realign the pelvis and correct any postural imbalances, help tone those surrounding pelvic and abdominal muscles, which in turn will help with mobilization, and just, realigning the pelvis will help to ease the pain and just give more stability around that hip and pelvic area. So yeah, that is really how massage can help with SPD. You do have to be careful during pregnancy. We talked a little bit there about massage of those muscles sort of on the thighs and sort of surrounding the pelvic area. You do have to be a little bit careful during pregnancy on the amount of pressure and what techniques are being used, but certainly postnatally, more pressure can be applied, and so you probably feel even more benefit then. As always, feel free to comment below or contact me with any questions through my Facebook or Instagram. Do subscribe and check out my other videos. There's quite a few others on pregnancy related issues, as well as the sports therapy side of things, and mental health and physical issues. So yeah, feel free to get in touch, and I will see you next time. All right, bye.